Hello everybody. I'm going to talk about first month in pregnancy. When do pregnancy happen? How do you know you got pregnant? What do you have to eat and what not? All these questions I'll answer you now in a very simple and easy way. I'm a consultant of obstetrics and gynecology. I'm going to talk in a very simple way about first month in pregnancy. First question, how do you know you got pregnant? First of all, you notice that you missed your menstrual period. You may also notice some symptoms before that missed period, especially if you are waiting to be pregnant. So you notice some new symptoms that you are not used to. For example, increase in size of breast and feeling breast tenderness. This is simply the very early symptom. Then you feel nausea and it may be associated with vomiting. It is mainly morning sickness. Vomiting may seem to be yellow and bitter. All this is because of hormonal changes. Fourth symptom is tiredness and mood changes. Fifth symptom is increased urination, that's to say polyuria. These symptoms may lead you to think you are pregnant, but you'll never be sure of pregnancy except when you undergo pregnancy tests. A beta subunit test in blood is recommended. This is more accurate than pregnancy test in urine. You have to do this in a laboratory. When that test is positive, now you are sure you are pregnant. Second question, when do pregnancy happen? Conception occurs about 2 weeks from the beginning of your last menstrual period. Your obstetrician will count 40 weeks starting from first day of your last menstrual period. Third question, it is scientific. I'm going to talk briefly in this subject. The sperm and ova unite in one of the fallopian tubes to form a one-celled unit. Here our baby is called zygote. The zygote travels down towards the uterus. At that time it begins dividing to form a cluster of cells resembling a tiny raspberry. It begins to burrow into the uterine lining called endometrium. Increase in the hormone called HCG, human chorionic gonadotropin, also increase in levels of estrogen and progesterone hormones, and for this reason amenorrhea happens. They are also responsible for nausea and vomiting at the beginning of pregnancy and also responsible for lactation afterwards. Fourth question, what should I have to do when I know I'm pregnant? First of all, I want to tell you that pregnancy doesn't mean you are ill or sick. It is a nice event. You wait for 9 months to have a baby. It will end easily and successfully, being happy at the end. I want to tell you some pieces of advice in your first month pregnancy. Number 1, full healthy diet. You have to eat small recipes, leaving intervals between these recipes. This is just because I want you not to nauseate and vomit. For example, now you drink a cup of milk. You may add chocolate, strawberry, banana to the milk, as you wish. After 2 hours, you may eat a piece of breadcrumbs. After 2 hours, you may have a spoonful of honey. After 2 hours, you may eat an apple. After 2 hours, you may eat a little piece of chicken or meat. Then some soup. At the end of the day, you'll find yourself ate beneficial food. To summarize, you have to eat meat, chicken, milk, honey, cheese, eggs, yogurt, fruits, and vegetables, especially green leaves, as parsley, rocca, and spinach. These are very useful for you. Also legumes as lentils, chickpeas, lima beans, and wheat seeds. Second piece of advice is to take rest. This word doesn't mean to be lazy. No, of course not. You may do your natural daily effort little by little. Then your body won't be stressed. Our aim is to care about your pregnancy. The zygote will settle successfully in the wall of the endometrium, as we said before. As for the working woman, she should be advised to take care not to carry heavy things, not to go up and down stairs too many times. Sexual relationships should be lessened, especially for those who have experienced past history of recurrent abortions. So she has to take care not to slip or be hit anyway. Fifth question, what are the forbidden habits during pregnancy? Number 1, fast food as chips, Pepsi, because these food will make you gain weight without benefit. Number 2, caffeine should be less than before. Nescafe, coffee, and tea may be a reason for growth retardation of the baby. Number 4, eating liver should be restricted during pregnancy because it's rich in vitamin A, which may cause malformation of the baby. Number 5, eating fish rich in mercury should be restricted during pregnancy. You may eat a little piece as half of your palm once weekly. Number 6, smoking is forbidden, and also you have to get away from smokers because this also may lead to retardation in pregnancy. Third piece of advice, you shouldn't take medication for every complaint you feel. Don't take too much analgesics. For example, if you have headache, leg aches, stomach aches, and these aches are not continuous, you can just skip and forget. Or you can take paracetamol and ask your doctor if you are still having these aches. Question number 6. What medication should I take? As your doctor prescribed, only folic acid should be taken. Your doctor may add other medications as Asposite 75 if the case is in need for this. Also, some medications that stabilizes your pregnancy may be added if your doctor prescribed, especially for those cases who have past history of recurrent abortions. Also, there are some investigations that I'm going to talk about in your antenatal care. I'll mention this in coming videos. At the end, God bless you. Thank you.